This video is about people falling down, especially middle-aged and old people, and I'm going to go through why are some of the most common reasons they fall. I've made other lectures on why people fall. This one I'm going to add a few new things. The other one I actually went into more detail, but the bottom line is most common thing that comes up is hypotension. Their blood pressure dropped too low because they overtreat their hypertension. The reason you have a blood pressure is to get blood to the top of your brain, cerebral cortex, to pump it against gravity. And if you're eating high-fat diets, high-sodium diets, lack of plant foods, then you end up hypertensive because you're pumping thick blood because of the fat through constricted arteries because of the sodium and the lack of plant foods, which are vasodilators. And then pressure has to go up to still be able to get blood to your brain. So if you take a pill and you rapidly drop that blood pressure systolic, let's say from 170 down to 120, you're not getting enough blood to the top of your brain. The old person will often fall. But in real life, things usually aren't that simple. They're multifactorial. The same person will be on the antihypertensive medications, number one. Number two, it's really hot in the wintertime, in the summertime, and people are sweating a lot, and they're often quite dehydrated, which lowers their blood volume, and that'll also contribute to hypotension. A lot of old people are on diuretic medications that dehydrates them and contributes to hypotension and potentially passing out. So I've spoken to emergency room doctors, and they tell me they think it's this combination of antihypertensive drugs, being on diuretics, and also on the hot summer days, they get more of these older men especially falling down and hitting their heads. And I work as a neuroradiologist is one of the things I do. And I cannot tell you, I've seen many thousands of old guy fell his head, BHT, blunt head trauma, rule out bleed. Every day, there's multiple of those in every hospital in the Western world. Okay, but I've got something totally new. That's why I put 2026 up here. Here's something totally new. There's a medication called tamsulosin. It's very common. It's used to treat BPH, benign prostatic hypertrophy, so a big prostate, clamping down on the prostate urethra, making it harder to urinate for old guys. And it's an alpha-1 blocker, meaning it blocks the alpha-1 receptor, adrenergic receptor. And by blocking that, the smooth muscle around the prostatic urethra will relax. It'll dilate, and the older guy can urinate more easily. But the catch is it can also cause relaxation of the vascular smooth muscle, and then they can drop their pressure. Okay, they can have orthostatic hypotension, regular hypotension. It can be quite significant. They can pass out and fall. One article suggested patients on alpha blockers, 14% increased risk of falling down. And these falls can be pretty serious. I've seen guys that just fall from standing. I've seen them, fracture their hips. I've seen them fracture their pelvis. I've seen them fracture their lumbar spine, like a vertical impaction loading fracture, even burst fractures, at the thoracolumbar junction typically. Okay, so what's the point? If somebody who's on that better be careful they're not combining it with hot, sweaty day, dehydration, diuretics, and overtreated hypertension. They're a real high risk to fall. Other things that increase the risk of falling, a lot of these I've talked about before. If you overtreat diabetes and you're hypoglycemic, it's much more dangerous to have your blood sugar too low than too high. Statin, and remember, anything that can make an old guy fall could also make him crash his car while he's driving, so they're dangerous. Okay, I don't take any medicines. I'm 63. I don't take any medicines. Okay, because I'm a low-fat vegan. Low-fat vegans don't need to hardly ever take medicines. Overtreated diabetes, statin medicines. Okay, Dr. McDougall has a whole newsletter about that. It can lead to people falling down. You can have muscle weakness. Alcohol is totally stupid. Opioids, stupid. Prescription drugs, sedatives, antihistamines, some antidepressants, SSRIs, antipsychotics, fluoroquinolones. A lot of patients, old guys, have polypharmacy, and there can be negative interactions between those drugs. A lot of old people are really weak, sarcopenia. They need to exercise. You got to move. They keep saying, eat more protein. It's not the protein. You got to exercise. Very few people are protein deficient. Tons of people are exercise deficient. Get your sleep too. You need that early part of sleep when you get that growth hormone that helps maintain muscle mass and strength. Spinal degeneration, causes weakness and pain in the back. That as the weakness progresses because they don't exercise anymore, they're more prone to falls. Being demented. Well, we know. Like I had a neurologist friend. She said her falls clinic was really a dementia clinic. And I notice that's real common. I see in guys before they're about to die, they start falling a lot. Fall, 6 months later, fall, 3 months later, fall, 2 months later, fall, dementia, dead. Okay, that's often how that one goes. Usually the sequence of events I see is poor dentition getting worse and worse and worse, lose all the teeth, cataract surgery, demented, dead. Antacids have increased incidence of hip fractures. Excessive dietary vitamin D pills associated with increased risk of fractures. Other causes, if they got any reason for dizziness, tinnitus, Parkinson's disease, blurred vision, you can treat the vision problems pretty easy. Poor lighting, clutter at night, water on the floor, falling in the bathroom, that can be bad. Ice outside, you get more falls with that time. So they got to clean up the path to the bathroom for the old guys waking up to avoid. But anyways, the most interesting thing I think about this was the tamsulosin, orthostatic hypotension, and falls. The other stuff too is important. Hot summer day, sweating, diuretics, overtreated hypertension, leading to hypotension. So I hope you found that interesting.